One. Hi, this is Eric Ruderman from Northwestern University, coming to you for Room Now from ACR Conventions 2020, which interestingly seems to be happening in my basement. I wanted to talk today about a couple of abstracts, one of which is today and one of which is tomorrow, in the psoriatic arthritis arena. And I wanted to talk to you about them, not so much for the specific results of the abstract, but actually for some implications that I think are really important as we think about new trials and new studies in psoriatic arthritis and in fact in other diseases. So the main abstract, which is going to be presented tomorrow, is called the Achilles Study. And this is a study of secukinumab in patients with Achilles tendinitis who had either psoriatic arthritis or axial spondyloarthritis. They looked at 200 patients, the bulk of which, 128 of them, had psoriatic arthritis and the rest with axial spondyloarthritis. And they had imaging and clinical evidence, according to the local site, of Achilles tendinitis. Patients were enrolled in the study and were randomized to secukinumab or placebo with the usual loading dose of secukinumab for the first month. Interestingly, the primary endpoint of the study, which was clinical resolution of enthesitis, and that's going to be presented in a poster tomorrow, was a negative outcome. And they did not show any significantly increased resolution of the enthesitis of the Achilles tendon in the patients who got secukinumab versus placebo, though many other measures of disease activity, including sort of overall measures of enthesitis, improvement in enthesitis, a variety of other things did show that secukinumab worked, not surprisingly. But the interesting piece of this, I think, was actually the presentation today. And this was abstract 447, presented today in an oral session in which they looked at the baseline data. And what was particularly interesting was that patients got into this study based on having clinical evidence of Achilles tendinitis and an MRI that was read at the local site, either by the rheumatologist or the radiologist, as showing tendinitis of the Achilles tendon. 100% of the patients had abnormal MRIs locally, but when they sent those MRIs to be read and evaluated by two central readers, only 56% of them had an abnormal MRI or had a positive MRI for tendinitis. So let me say that again, 56% of them. So just about half actually had what they considered the inclusion criteria for the study. So this brings up a bunch of issues. And the first question is, all of these patients, at least as far as we know, had clinical enthesitis as judged by the investigators at the local site, and yet only half of them had abnormal MRIs when read by a central reader. And this would suggest that there's a big disconnect between what we see clinically and what we see on MRI. And that's not news. We've seen that before with ultrasound imaging. We've seen that before with MRIs in other locations. MRI and other imaging tools tend to be more sensitive. But what I think is actually the most interesting thing about this was the disconnect between what was seen locally, or at least read locally on the MRI, and what was seen centrally. And there, it turns out that, again, only half of the patients who had abnormal MRIs when read locally still had abnormal MRIs when read centrally. And we've seen this sort of data before. We've seen this before, not in psoriatic arthritis, but axial spondyloarthritis, where local reads of sacroiliac imaging don't really match up with central reading. And it's pretty similar numbers, that about half of the central reads turn out to be negative, even when there was a positive local read. And I think this gives us some pause. And I think that particularly as we're thinking about studies and trials that rely on imaging as an entry criteria, this study, and in the presentation today, Dr. Baraliakos, who was the presenter who led this study, acknowledged this, that in studies that use imaging as an entry criteria, we really need to have consistent central reading of the imaging in order to know that we're dealing with apples and not apples and oranges. It seems like a small point, but I think going forward as we get more and more trials, and particularly trials that look at comparisons between different drugs, it's going to be critically important to think about this. And so that's my takeaway. Does this change clinical practice? I'm not really sure, but I think it does give us some pause as to what's really there when MRIs are read locally. And it's a totally separate topic, but there's some other interesting papers at this meeting looking at using um, computer analysis and machine learning to identify features on imaging studies. And maybe that's the way forward. And maybe that the central read could be done by a computer and not by a radiologist. That's down the road, and that's certainly speculative. But for me, the key takeaway is in this study, the local reads didn't match up to the central reads. And perhaps, and this is also speculative, perhaps had they matched up, maybe it would have been a positive study. Unfortunately, we'll never know that. Anyhow, lots of information on psoriatic arthritis in this meeting. This is just another tidbit. I look forward to seeing more, and tune into Room Now for all the information about ACR convergence.